Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Dark Angel asks the question, how do I know if my son has severe autism? Which is an interesting question.
It's actually a great question, and it has to do with, I think, a couple of different things. It has to do with the number of symptoms that your child presents, because so the diagnosis of autism, and if the viewers want, I can actually go through it at one point where we just focus on the diagnostic criteria at a different show. And the diagnosis has two kind of sections. One section is what we call social communication section, and the other section is the repetitive, stereotypical repetitive behaviors, the stimming, as you referred to before. And, well, actually, the stereotypical repetitive behaviors is where also under that category, they've also listed the sensory and so on. But anyway, there's a number of symptoms within each, and you don't have to have all symptoms. You just have to have a certain number within each category. Now, if you happen to have more of those, then obviously there's a little bit of more of the disability, right, that you're dealing with. So, for instance, in social communication, it could be that you are unable to interact with peers. And of course, that is, vocally interact with peers or verbally interact with peers, and that's difficult, right? That for sure is a difficult thing. But you could have that, and on top of that, also have a delay in non-communicative, non-vocal or types of communication, like eye contact and body gestures and so on, which means at that point, you're also not able to look at people, not able to read body language, not able to understand a lot of nuances of communication. So the more symptoms you have, the more the disability is affecting you. Now, also within each of the symptoms, you could have multiple issues. For example, when we talk about self-stimulatory behavior, or just that category of repetitive stereotypical behaviors, you could have just a couple. Like, for instance, a lot of children who are anxious will line up objects, and that is classified as one of the self-stimulatory behaviors, lining up objects. On the other hand, there are children who have such severe sensory issues going on that they have 10 different self-stimulatory behaviors. For instance, they will not even be able to look, they will be gazing, they will be throwing stuff, they will be spitting just to see the direction of the spit, they will be doing this. So the more symptoms you have, you are struggling with a more severe form of autism, because all of these symptoms make it harder for you to learn. And I think that is the key to the severity aspects of it. And we do have, Shannon, that's the other reason I really liked the 2013 version, is that now that they put kind of ASD as a whole into one spectrum, what they also did was they gave us the ability to put down in each area, so one in the area of social communication and one in the area of stereotypic repetitive behaviors, a number from 1 to 3, indicating severity, and the way they define it is indicating the level of support required. So if it's a 1, you need a certain amount of support, but if it's a 3, you need a ton of support in that area. And this is super important, because a lot of people, when they diagnose, they do it wrong.
And give one number.
I mean, it's just, you give one number, and you cannot give one number, because there are children who are pretty high functioning and very minimally affected in the area of, let's say, stereotypic repetitive behaviors, so they would get a 1 there, but they're very affected in the area of social communication, so they might get a 3 there. And a child whose diagnosis is 3-1 is extremely different from a child whose diagnosis is 1-3. I mean, it's just it's important, because that helps us as diagnosticians paint a picture of the particular child's needs. And until we know more about autism, that's all we have. We have the ability to describe each individual as accurately as we can, so that we can treat them according to their needs and not according to a cookbook. So that's why I'm very, like, I think those numbers are super important.
So what I remember when my son was first being diagnosed was that all I wanted was somebody to be honest with me and say, you know, where is my child on this spectrum?
Right.
Like, is my kid going to be Bill Gates, or is my kid ever going to be out of diapers? He was 2.5.
Yep.
And I just wanted somebody to be honest with me about that, and no one would be. And I railed against that. I was like, why won't somebody? And sometimes people would say, well, we just don't know.
Yeah.
We don't know where he's going to end up. And I sort of I needed somebody to tell me, like, what was the best case scenario, what was the worst case scenario. Now looking back on it, I'm glad that no one did, because then I had to go out and I wouldn't look for the worst case scenario. I would look for the best case scenario, and I would ask questions of, how did you get there?
Yes.
But later on, when my son was doing better, I got to look at documents and see that they had classified him. Back then there would be mild to moderate or moderate to severe. And he was classified as moderate to severe. And I know. And I think that would have devastated me when he was little. I think that would have taken the wind out of my sails, and I might not have been able to do what I did. Right? So I'm kind of glad that nobody told me that. But I do want to put that into people's backpacks, that what they say about you and your child, when people say things when they are younger, that there are different times and places in the course of a parent's time with their child with autism and their child's development. And I want to say that if your child is under the age of 5, take it all with a grain of salt.
Well, even if they're over the age of 5, because the reason that they're learning, so this changes. So you could, and I have started with children who are severe. I mean, when you say severe, that means the child is continuously self-stimulating. So like, and I will describe a child to you, and I want to see if you can guess. They're running around in circles and going ee like that, right? Not vocalizing at all, not interacting at all. Very, very resistant to any kind of learning, tiptoeing everywhere and just running extremely hyper, and you know, not able to communicate their needs, not potty trained, not even paying attention to what's going on in the environment. That would be a child who's severe. But then over time, that child learns to stop running around and sit down and pay attention, and that child learns to request things instead of hitting and being aggressive. And that child learns to listen and learn from their environment, observational learning. And as that happens, they're no longer severe, right? And they are still affected, but now they might be moderately and then very lightly affected. And then that's how we actually help children overcome this diagnosis, right? Is they learn. And it doesn't have to be a young child. It could be anyone, if you really think about it, Shannon. If you're learning to overcome those parts of your disability, then you're no longer struggling with them. It's really that simple.
And I love that, and I get emotional about it, because you didn't get to meet Jem until he was a little bit older, but people that you trained were working with him, and it was like a year ago that I showed you video of him. And you were like, oh, wow. Because he'd made so much progress by the time you got to actually be in the room with him, which I fought for, by the way. But anyway, I don't mean to discount the children that are over the age of 5. What I was trying to say is that I wouldn't listen to what anybody says prognosis-wise with a child under 5. I would take it with a complete grain of salt. When your child is between the ages of 6 and 10, I would not give up at all. I would still be fighting, but I would be asking more pointed questions if your child has already been in therapy and not making progress. I do see that when children start to be 11 to 13, that is when the reality police kind of come in, and sometimes parents have to go through a grieving process to realize, okay, I'm not going to win the lottery here in terms of my child,
completely losing all symptoms.
Right. And that, and maybe there's something else that's going on and it really is a very hard time between the ages of 11 and 13, because it's really when you start, I think on both sides of the fence, you start to say, okay, I have to change what I think is going to happen. And I'm going to say that, my good friend Nancy Alspaugh-Jackson, who's going to be here on Thursday to do our Halloween show, what was interesting was that we were very good friends with boys on the spectrum.
Yes.
And we had to go through that time together with different outcomes.
Oh, absolutely.
And that during that period of time, Nancy was realizing, oh, my child is not going to recover. And I need to start making plans for the future of how we're going to continue to help him to grow, and he has.
Yes.
But that what his life is going to look like and how much support he's going to need. And it was really devastatingly hard for her. And I was sitting directly next to her, hosting a show with her, with a child that it was occurring to me that maybe my child was going to be like, and that hadn't, as much as I had fought for that, I didn't have a world prepared for him to go away to college.
Yeah.
I didn't have a world prepared for that he was not going to live at home. Because it's that Schrodinger's cat of you don't know what it's going to be, and then suddenly you do get an idea of what it's going to be, and you have to deal with the outcome. And believe me, I have survivor guilt, you guys. And Nancy and I have shared that with each other and shared a lot of tears over it. It's a hard time, that period of time.
Sure.
But I think that moment when the child is 13, when you're having to look at, okay, which road am I probably on? I think so often people have 4-year-olds and they want to know. And I don't want them to know at 4.
So this is kind of an important discussion, because I think in your case it was 11 to 13.
Yes.
There are parents who will know at 6.
Okay.
There are parents who will still not know at 13.
Yeah.
So it's very, very hard to know when things are plateauing.
Yeah.
Because you're living with the child day to day, and you won't see the changes unless you are, away from the child for 6 months or something. It's just hard to see. Now, I want to say that the way that I look at it, Shannon, is that learning with our kids is interesting because we're learning as they're learning.
Yeah.
It's a very interesting kind of dynamic when you do good therapy, because you're not just going in and saying, these are the things you need, and I'm going to teach them to you, and we're good to go.
Yeah.
You start out with a picture of what you think the child needs, right? You're like, okay, I need to teach you how to request things. I need to teach you how to imitate sound, whatever it might be for that child, right? You have this huge array of skills that you want to teach, and you start. And then as you start this process, you're like, oh, well, you're not learning, so I guess I have to figure out why. And you put your curriculum aside for a minute, which is the content, and you start figuring out the child's modality of learning. And this is very pertinent to the whole sensory issue.
Yes.
And you start thinking, okay, wait a minute, you're a fully visual child, and everything I've been saying to you right now is just coming in as blah, 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 and makes no sense at all unless I show it to you visually when I'm trying to teach you, because you learn visually. And then as you do that, then you start to be like, oh, you're learning again. Great. So now we're off the plateau and jumping up again, right? And then you hit another phase where you're like, and this could be at any age. And you're like, okay, the learning has stopped or slowed down. What's going on now? And then that could be a stage where a parent could mistakenly think it's over.
Yeah.
It's over, he's never going to learn. And then I come in and I'm like, no. Let's look at his sleep. Let's look at his medical. Let's look at his environment. Let's look at the people around him. Is there someone giving clues where they shouldn't? Is there some environment that is causing him so much anxiety that he's no longer willing to learn? Are we overloading him? Is there just too much going on and not enough reinforcement? Is he not feeling well in his gut? Is he not sleeping? And these are all the things that are super, super, super important, because you could conclude that the child is stopping and this is where he's going to be forever. Or you could look at yourself and you could figure out what you're doing wrong or what's missing. And until you do that, no matter what age, 5, 6, 13, whatever it is, and you do everything we so far know in science, and that's kind of one of the things for me is that I regret so many things we learned later that some of my children in the 80s would have benefited from, but we just didn't know. You know, and as you learn and you get better, and there's still room for a lot of learning, but as a parent, you have to be open and you have to listen to everyone and you have to try different things and you have to see what works for your child. And until you do that, you can't make any conclusions about your child's abilities, because the one thing that is for certain with our kids on the spectrum is they learn differently. Their sensory input is different. Yeah. And that's kind of what we're talking about, which is, you know, the sensory issues.
But this is why you know, one of the many reasons why I love you is because you have such a sense of hope and listening to the individual.
Oh, for sure.
And that we as parents should not give up. So I love that.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.